Hi, everyone. Thanks for joining. We're going to wait just one more minute before we get started. Hi, everyone. I'll keep talking while we figure out what's going on with our presentation. Welcome to this weekly seminar in migrations. This is part of an ongoing initiative at Cornell's campus on migrations, a global grand challenge, where we look at the movement of people, plants, and animals and the context in which they move, where we investigate this from multiple perspectives, many different disciplines, across time periods and across space. We're so excited to have Jen Meredith here today to talk about her work. And as timely as it is, I would say that the global pandemic highlighted the need for this sort of interdisciplinary approach to migrations. Not only thinking about particular microbes that migrate from one set of animals to humans, but also the way in which humans themselves move around the planet and take the microbe with it. So we're delighted to have Jen Meredith. Right now, I'll introduce Blake Martin. He's a senior class of 2021 in the College of Arts and Sciences, studying as his major science and technology studies with a minor in nutrition and inequality. And Blake will introduce Jen. Thanks, Blake.
Hello, everyone. Welcome to week 8 of Cornell's Migration webinar series. My name is Blake Martin, a senior in the College of Arts and Sciences. I'm currently a biology and society major while minoring in both nutrition and health, as well as inequality studies. Throughout these studies, I have come to appreciate the interdisciplinary approach taken to resolve complex issues around the globe. Therefore, my participation in the migrations, a global interdisciplinary multi-species examination course, has grown to be one of the highlights for each and every week. Today, I have the pleasure of introducing the speaker for this week's webinar on migrations and One Health, animal-human relations and emerging diseases, Professor Jen Meredith. Professor Meredith has served as the Associate Director of Cornell's Masters of Public Health program since 2017, holding a Master's of Public Health from the University of Massachusetts Amherst and a doctorate in Public Health from the University of Illinois at Chicago. With a fervent desire to change the world through a data-driven approach, her work focuses on not only furthering institutional development with respect to disease surveillance and response, but also creating effective public health leadership and management systems across the globe. In 2019, Professor Meredith became a faculty fellow in Engaged Scholarship. As a proponent of engaged learning and research at Cornell, she is responsible for creating the next generation of effective, compassionate, and professionally competent public health practitioners. A community-based approach towards public health will better support the needs of socially diverse populations by working with community coalitions and cross-sector partnerships, and gauging the effectiveness of local initiatives. This is especially important with the current climate of social unrest in our country, as well as the legacy of systematic disenfranchisement still wreaking havoc on various communities of color. Prior to Cornell, Dr. Meredith spent over a decade spearheading large international development projects, where national public health system development in sub-Saharan Africa, the Caribbean, as well as the US was her primary concern. Her scholarship, as well as her engagement, both encompass important topics for the sake of public and environmental health, especially in light of increased emergent infectious disease prevalence and the precarious implementation of biosecurity measures in various ecologies. Now, I would like to remind you that there will be an opportunity to ask questions at the end of Professor Meredith's presentation. Note well that the question and answer function, not the chat function, will be the primary tool to inquire and will also feature any questions submitted by the webinar audience. I really hope that everyone is excited as I am for this presentation, and I will now turn this conversation over to Professor Meredith.
Good afternoon, everyone. Boy, Blake, thank you so much for that introduction. My face was probably quite red. I am one of those people that doesn't really enjoy hearing others talk about me. So thank you very much. And Wendy, so nice to be here as a part of your class and a part of this initiative. And also a huge thank you to Eleanor for helping get this all set up and get me organized. So can I just ask, maybe through the chat function, can somebody let me know if you can see my presentation screen?
Yes, you're
Fabulous.
good.
Fabulous. Okay, so let's get started. So happy Wednesday. It's really a pleasure to be here with everyone. As Blake mentioned, my name is Jen. I currently work here at Cornell as a part of the MPH program. And as Blake really nicely touched on, I serve as a teacher, an academic leader, and as a community engaged researcher. And in this role, I am really invested in helping to build the public health workforce of the future, including partnering with communities and elevating the opportunities that they identify, the needs that they identify, and the processes that they developed linked to improving the health and well-being of populations. In addition to my role in teaching, I also have active projects related to student employee mental health and well-being, especially utilizing the role and the benefits of nature to improve mental health and well-being. The application of systems change to support and improve community food security and sovereignty, and the use of community engagement and data collection to support and improve COVID-19 prevention and reduce community spread. Prior to coming to Cornell, I had the privilege of working for and with communities globally, largely focusing on HIV prevention, HIV surveillance, and connection with treatment and care services to reduce the impact on people and their communities. This work, implemented largely with government and community leaders in very diverse settings, has really influenced the way that I think about, teach, and do public health work even today. And so today, I hope that that'll come through a little bit in what I share, and I really look forward to having some Q&A with you at the end. So I'm going to touch on 6 key themes today. Well, I'm going to touch on 4 of them, and then together I hope we'll touch on the last 2. Those include an introduction to public health and public health systems, talk about some challenges to maintaining public health, introduce some accessible and powerful lenses that we can use to improve public health impact. And then together, I hope we'll be able to hone in a little bit on some of the lessons that we're learning, and share some ideas for the future. So we're going to get warmed up a little bit. I really like to invite interaction during the lecture, and I will a couple of times. So I'm just going to ask you this question in the chat. What does public health mean to you? Community-focused well-being.
And I know we said that we would use the Q&A, but feel free to actually type your answer into the chat function for this kind of interactive moment.
Great, thank you. So community-focused well-being, state-sponsored healthcare. There's some other ideas. Education and prevention regarding disease and hygiene, making sure that it's accessible, wellness of a community, overall well-being of a society and how it's addressed by government, holistic approach to community health, sociology of well-being. Excellent, excellent, excellent. So for those of you who don't know much about public health, I'm just going to do a little bit of an intro. So public health is a field of work made up of many different types of professions linked to keeping people and communities healthy. Per the World Health Organization, public health is defined as work that seeks to prevent disease, promote health, and prolong life among populations as a whole. And this includes helping to assure conditions in which people can achieve health. And so here are some examples. The teams of disease detectives that work to track, diagnose, and contain communicable diseases, and the scientists that develop vaccines, and the community health teams that get them to young people and their families. The teams of veterinarians, farmers, and technicians that keep our food and food systems safe, and the engineers and community workers who develop and install potable water and wastewater systems. The educators who help people understand the risks of behaviors that impact long-term health, and the educators and organizations that help to support positive health behaviors, making the healthy choice the easy choice. And the clinicians who help mothers and parents space their children and plan their families, and the programs that support child and youth health, growth, and development. So ultimately, this links to all things that are being done in communities and around communities to assure physical, mental, and social well-being, not just the absence of disease. And as you can probably appreciate, especially for those of you who are studying psychology, there are some really important foundational areas that support health: food availability, clean air and water, employment and income, community wealth and security to ensure housing, shelter, and infrastructure, as well as social stability. These are vital to allow each of us to live our best life, or actually just to live a good life. And I'll pause for a moment and just ask you to consider. You don't need to type anything, just think. What would you do if you didn't have these basic needs? Might you consider changing your actions or your behaviors to gain access? Might you consider migrating, moving to a different location to improve access, or to at least flee harm? Now, I'm guessing that 8 weeks into this migrations course, this is a theme that you are noting. People and animals need key elements to have health and to live. And people and animals will do all that they can do to assure this. And people and animals will move to find those elements if the local conditions are too dire. So where does public health fit into this? Well, I might argue, being who I am, being the background that I come from, that public health fits in everywhere. But what I'm going to talk about today is balance, and trying to find ways to get back to a place of balance. So to get to that point, I'm going to start with a few places of where we're out of balance. So the number of people living on this earth is currently increasing exponentially. Really, our population grew by more than 300% in about 50 years. So think of that. Our whole earth, 50 years ago, there were 2.5 billion people. Now there are almost 8 billion people. And I was trying to put that into a frame that we could think about this. And here's my best analogy. Think of Ithaca College and the beautiful campus that's at the southern end of the lake that looks all the way up Cayuga Lake. And think about, over the course of 50 years, Ithaca College with their defined campus, the defined buildings that they have, all of a sudden had the number of students and employees that Cornell has, i.e. moving from about 5,000 to about 20,000 in a period of 50 years without changing the size of their campus. So what do you think happens in a context like that? What happens when there's a 300-fold or 300% increase in a population in a defined area? And I will ask you to put some ideas into the chat. Resource drain. Excellent. Any other ideas besides resource drain? Higher disease transmission. Hannah, if you're willing, do you want to type in a little bit more about why higher disease transmission? More pressure on resources, lower standard of cleanliness, density of people, more vectors. Great, great. So as the population has expanded so much, we are seeing health and wealth. Some people, we're seeing big changes in health and wealth, as some people have access to resources and means, but that often comes at the expense of others. So we're seeing large portions of the global population affected by infectious and chronic diseases, impacted in large part by the physical and natural environments that they live in. So of course, some people are not all that affected, but there are definitely many people who are affected. So one specific example is malnutrition. Currently, there are about 7.8 people in the world, and there is an imbalance as it relates to nutrition, food access, and what we call the triple burden of malnutrition. So about 1/3 of all people experience malnutrition in that they don't have enough food, or they have too much food, or they have the wrong types of food. And it plays out like this. About 2 in 5 adults are overweight, which can lead to cardiovascular disease, diabetes, immobility, and depression. And about 1 in 12 adults have diabetes, which can lead to blindness, kidney failure, heart attack, stroke, and even lower limb amputation. Poor nutrition causes nearly half of all deaths in children under 5. And 1 in 4 children globally are stunted, which leads to irreparable damage in their growth and development. So as you think about this, revisit those basic needs. Food is among the most important, and think about the strain of that. If 1/3 of the global population is under strain because they don't have ways to get food or the right types of food to support their health, there's pressure. It's more nuanced as we dive a little bit more into the data. So here we can see that it's generally the global South and Asia that are most impacted by insufficient food access. And that, in contrast to the global North that is more so impacted by overnutrition and rising rates of obesity. So as resources are being strained in one way, they're being strained and have an effect in another way in other countries. We also know that there are disparities within countries. So I'm going to dive in a little bit more to the US in this case. And we can see here, for example, that Black and Hispanic people are more heavily impacted by obesity than white people in the US. And the same holds true for food insecurity. Unfortunately, these types of disparities are not uncommon when we look at many types of public health issues here in the US, in New York State, or even globally. Access to safe housing or shelter, access to clean water, air, or land, access to food, access to fair wages and accessible education, and access to healthcare. Across all of these, we see disparities that influence ill health, conflict, migration, morbidity, and even death. And from a public health perspective, we seek to take action. So in introducing public health, I spoke about prevention, and this is how we try to mitigate the impact of disease or injury and avoid it in the first place. So for example, tertiary prevention. If diabetes is diagnosed, we seek to work with people to modify their diet and their lifestyle and to have reliable access to medication, thus to reduce impact and to limit disability. Sorry, I lost my mouse for a second. If an illness like the flu or breast cancer is detectable through screening, we seek to screen for it, diagnose it, and treat it to limit the impact and the harm that it has on that individual. But perhaps most importantly, the largest scale where we try to have the most focus is we try to work to prevent this from happening in the first place. And this includes making sure that people have reliable access to the core elements that they need every day of the year. And these are called the social determinants of health. So these core elements account for about 60% of people's health outcomes. And these are often impacted by the structures and policies that are in place that gatekeep access. Those are things like systemic racism, police violence, and oppression based on race, ethnicity, and gender. So what do we do with this knowledge? What do we do to try to get ahead of the curve and to prevent and mitigate impact, especially when we're thinking about things like these social and structural determinants of health that are very large scale? Well, we rely on 3 core functions: assessment, policy and program development, and assurance. And I'm going to dive into each of these. So assessment means the systematic collection, analysis, and dissemination of information about health, or the lack of health, or the barriers to health in communities of interest. And I want you to just pause for a moment to think about why this might be important. You don't have to write it in, but you can think about it. This is really important because we want to be able to describe the who, the what, the why, the when, the how, and the how much. Who is being affected? Who is being impacted? By what? What is it that is causing harm? Why are they exposed to that? When has this happened? How has this happened? And how much of the population is affected? So that second point then informs policy and program development, which is the use of this information, this knowledge and evidence base, the science that we have, to inform policy and programmatic decision making. And so again, I ask you to think about why this might be important. And hopefully you're thinking along the lines of, well, where we have limited resources and we have some constraints, what's really great and important is to get the right thing to the right place at the right time. And so what follows from that is assurance, meaning being able to ensure the provision of the services to the people who need them most. And of course, this is important because we want to assure access. We want to make sure that people with need get the services that we've designed to meet those needs. But we also want to really front load a focus on equity in this case, and to make sure that the people who need it most are able to be the ones to access the services. So this is all fine and good, but what happens when there are cracks in the system? What happens if we can't assess gaps or needs? For example, what happens if our disease detection systems or surveillance systems are weak? What happens when we can't accurately identify the who, the what, the where, the when, the why, the how? What happens if we don't have a clear leadership voice helping to guide what to do, when, and where? What happens if we can't get that right thing to the right place at the right time? And what happens if we can't connect people to the services that we have or to the services that they need, or in fact, if the services simply are not yet available? Well, here's just one example. Back in February, we became aware of a new virus that was infecting people, resulting in deaths early on of something like 4% of people. Since then, we've seen this virus cross every kind of border, enter every kind of door, and thrive in places where people enjoy time with each other. This has really shown that we have cracks in our public health systems, our social systems, and our geopolitical systems. As of yesterday, this little virus has impacted a lot of people and has resulted in a lot of deaths. We know that in the US, the country most affected by SARS-CoV-2 right now, the impact has been especially severe among Black, Indigenous, and people of color, resulting in death, chronic disease, job loss, home loss, food insecurity, and strained mental health. This is in a time when we know these populations, these communities were already under more strain than many others. We also know that globally, in addition to all those same issues that I just mentioned in the US, COVID-19 might be just one wave of impact, followed by substantive changes linked to food production, food access, and global economic shock. We are anticipating that more people will suffer, not just from coronavirus, but from the impacts that this has had on our global systems and our economy. So what do we do about it? Not going to get to that slide yet. I'm going to share 3 lenses that we've been using to consider and examine this pandemic and to reinforce learnings for the future so that we can have a stronger advocacy voice now, meaning us, all of us here present right now, can use our voice in the way that we need to. And so that graduates, for students who are coming up behind, whether it's students here at Cornell right now, whether it's students who are experiencing different experiences in their university education, in their college education, in their high school education, in their elementary school education, so that these individuals, these students, can learn to take action in the future so that they don't allow this current experience to be repeated again. So the first lens that we've been using to consider this is the health impact pyramid, which helps to remind us where to apply efforts that have the greatest impact. So what this shows, if you start from the top of the pyramid, is that clinical interventions and one-on-one counseling is good and it's important, but it takes a lot more time and effort and resources and actually affects comparatively few. What the health impact pyramid helps us think about is better investments can be made upfront, especially to focus on things like those social determinants of health and the structural determinants of health, so that many, many, many more people are on a level playing field related to health and health access right from the start. If we think about this in terms of COVID-19, as an example, while hospital-based treatment is available and effective for some, it's actually not accessible for all, it's costly, and it doesn't help everyone. People will still die once they access hospital-based care. So rather, what we want to be able to focus on is prevention. Things like vaccination, when we have that option, and layered COVID transmission mitigation strategies, such as mask wearing, such as utilization of physical barriers to keep airflow and virus transmission low, to have changes in workflow and our common practices. So changing the environment so that a healthier choice becomes the easier choice. What we have also learned through the coronavirus pandemic, and especially looking at those who have been most affected by the disease and where mortality rates have been highest, is that reduction in other chronic diseases is really, really important. Things like reducing smoking rates, reducing cardiovascular disease. Now, this is not a quick fix, but it's something that has really been brought to our attention and pushed to the forefront, I think, loud and clear. And on top of that, focusing now and for the future on dismantling those structural barriers that I mentioned to assure equity in access to the social determinants of health, fair wage jobs, housing and school reform, healthcare access, to be able to focus on preventing illness and disease before it starts, making sure that those conditions in which people live and work and play are setting people up for success. Now, layered on top of this, something that we should be always remembering is the important role that our natural and built environment plays in our lives, in our health, and in our well-being. So linked to that, the second lens that I'm going to share is the One Health lens, which is the idea that the health of all things is connected. Now, this is not new. This is, in fact, an idea that Hippocrates first had more than 2,500 years ago. However, the importance of this lens has become so clear in the last decades, as we've seen human health be impacted because of natural environments around or the animal environments that have been shifting. Now, the goal in using a One Health lens is to ask questions in new ways or to look at causative factors or impacts in a comprehensive way. We do this by getting people with different backgrounds and expertise together around a table and asking why, and but why over and over again, seeking to develop a web of relationships, interactions, and influences. This helps to build key understanding. So So I'm just going to pause for a moment. Again, you don't have to type stuff into the chat, but I'd really like you to think about some One Health interactions that you may have seen play out in your own environment. Things related to how human health is impacted by changes in the environment, or how animal health is impacted by changes in the environment. Think about how that might have impacted you or your neighborhood or your community. So some examples that my colleagues recently compiled are this: the impacts of industrial swine farms on local environments and of people's health, especially in times of natural disasters where water levels rise, for example. The impacts of animal-borne anthrax on communities in sub-Saharan Africa. The causative factors of the emergence of Ebola in Democratic Republic of Congo and the impact that that has on human health. How urban planning impacts diarrheal disease in countries, in cities, for example, Port-au-Prince, Haiti, built on a hill, lower income people tend to live at the bottom, water rushes down. Why forests are being cut for palm oil plantations in Malaysia or for cattle farming in the Amazon, and how that impacts human health. What is contributing to wildfires in California or Australia, and how the fires will impact human, animal, and environmental health in the long term. So here are a couple of specific examples I'll share to just walk you through the One Health paradigm. So imagine you're doing some research in a rural village. You're living in a community and helping to support water access. All of a sudden, sorry, I lost my mouse for a second. All of a sudden, local livestock that people depend on for food, for fiber, meaning the fur, that they rely on for fuel, meaning helping to plow fields or helping to move from one town to the next, or for income, starts dying. Or let's imagine villagers start dying. So this is not good for health and well-being, nor is it good for economic stability. So to start to solve this problem, you may go to a vet, you may go to a doctor, you may go to a nurse, and that might help in the short term. But what if this keeps happening? Hopefully, you might be able to get some farmers and vets and nurses and long-term residents together to start thinking. And you might ask all those why questions. Why are things different? What is different now? What is occurring? What might be occurring? What is influencing us? Are there things that are different in our environment this year as compared to other years? Has the weather been different? Are we experiencing things that are uncommon? Are we using or consuming food in different ways this year? Asking all of these questions is very key. Trying to figure out how things have changed over time. Well, this is exactly what some communities and some researchers have done to get to the bottom of Nipah virus in Malaysia and Ebola in West Africa. And in fact, we're starting to be able to do this for coronavirus. For both Nipah virus in Malaysia and Ebola in West Africa, it was identified that forests were being cut down and that there were drought-like conditions. So this got communities pointed in a direction. And then by asking lots of why questions and trying to figure out what fewer trees and vegetation meant, new answers emerged. For example, when there is limited vegetation, mammals migrate to access food, right? So there's less food available, animals start to migrate to where there is food available. If food is scarce, this can mean multiple species crowding together to share the same food. And when this happens, especially if there's conflict among species, fighting for food or for territory or for mates, viruses that are harmless in one species can jump to another. Now, in the case of Nipah virus, it was found that bat droppings on fruit, so the bats were coming towards the trees, dropping their droppings on the fruit that was then falling onto the ground. And pigs that were using that same source for food then ate the fruit that contained the virus that was in fact deadly to the swine. So a virus that was harmless in bats all of a sudden became deadly to swine. In the case of Ebola, it was found that humans interacting with and consuming bushmeat, and maybe possibly bats, exposed them to a virus that was deadly to them. So obviously, in the moment, these were not simple problems that were solved in an instant, but they show the benefit of taking time to explore and to ask really good questions of lots of people about how interactions within the environment and with animals are changing, and how that can help answer a confounding question. And in doing so, these communities and many others now have a deeper sense of what impacts land use and weather and or animal interactions and or human behaviors have on ultimate community health outcomes. So one can hope that there might be reconsideration of land use agreements or some heightened awareness when they are experiencing drought now to help avoid these problems again in the future. So hopefully you have a question that remains in your head. And if you're thinking about this dynamic, maybe you'll ask a big question, which is, let's take a step back. Why was that land deforested? What was causing that dry weather that was creating these conditions for viruses to jump and to emerge and to impact people? So that's where planetary health comes in. So here's the One Health framework again, and the recognition of all these elements has on human health. Now, what planetary health recognizes is that this impact on human health in turn impacts our global population, our economy, and our socio-cultural practices. So in one way, as some of our earlier charts showed, when we have great health, our populations grow, we industrialize, and we use more. You all pointed that out in the chat before. But this overuse then causes harm to the One Health balance, such as climate change, loss of food, deforestation, and along with that, the emergence of new diseases and invasive species. This then has a negative impact on human health, and this often disproportionately affects some communities over others, as we have seen in the data that I showed earlier. So this is a cycle that we need to change, but this is really hard, and that change means changing human behaviors at the local level, but then also at scale. So here are just some examples of the impacts of planetary health, or impacts that have alerted us to the importance of planetary health. As our population has grown over the last decades, we've consumed a lot more energy. We've consumed a lot more water. We've cut down a lot of our most biodiverse land. We've produced a lot more carbon dioxide, and we've made our oceans more acidic. And the overuse of these resources is playing out in many ways. When vegetation is not intact, soil runs off and plants, our food, can't grow. When forests are disrupted, animal species, including humans, need to compete for those same limited resources. So not only does someone go hungry, but then pathogens have the potential to jump and spread between densely packed species, as I mentioned before. When high density development happens, i.e. emergence of cities, the ecosystem changes. When we raise land, when we put up buildings, when we put in roads. Wildlife balancing loops then change, and pests are no longer controlled, or water must be stored to ensure access. These are issues, for example, that are thought to be associated with a rapid increase of tick-borne and mosquito-borne diseases in the US. So building on the example that I gave before, the planetary health lens asks us to ask a few more questions about why. What are we doing as humans to spur the conditions that are impacting our health? What can we possibly do differently to better support the environment we live in and the ecosystem services that it provides to us? As you can likely identify in the space where you live and work, humans have the ability to use resources a lot and to really change and impact the context and the environment around them. Some of this is driven by need, including basic needs for survival, as we talked about before, needing to ensure access to those basic elements at the core of that pyramid. But in some case, this is also driven by, let's say, a need for greed, using resources at the behest of stakeholders, of shareholders. So some of these issues may be beyond our immediate control. Things like excess heat and climate change and drought. These are things that would require broad-based advocacy and large-scale policy change. But we can't ignore these factors just because they're hard. For these factors, we need to be aware and acknowledge them and play a part in long-term change, including by voting and through advocacy, which can include telling important stories about impacts. Hopefully, we're all finding a way to do that. However, some factors may be understood, addressed, and or modified locally, working in partnership with communities and community members and understanding why things are being done the way they are. For example, maybe there are new ways to use land. Are crops not being rotated, or is soil not being retained for a specific reason? Maybe there's something that we can do as a community to change that. Maybe there are alternative ways to relieve economic strain on some individuals. Why are some residents engaged in higher risk or higher reward practices, such as wild meat trade, or actions with long-term impact, such as tree cutting to produce and sell charcoal? Maybe this is to feed their families. Maybe this is because there are no other economic options. So the question becomes, at a local level, at a community level, are there alternative ways to meet those needs? Maybe there are ways to begin to nudge, very respectfully, traditional cultural practices, such as eating raw bush meats, helping to limit risks and exposure. But it's important to first ask, what are the factors behind those traditions? Are there true needs? Is this the way that people are meeting their food and their calorie intakes? Are community leaders aware of the risks that might be inherent? Are there ways to generate alternative practices or alternative sources that can then better protect health? So I wanted to just lastly come back to SARS-CoV-2 and coronavirus. And so, I preface this talk by trying to learn from the past and now to inform the future. And as one of the papers, as both of the papers suggested, we understand a little bit about the emergence and how viruses can jump between species. We also are understanding a little bit about the emergence of SARS-CoV-2. And here, what I want you to just pause and reflect on before we get to the Q&A is, let's say that there are resource overuse and resource demands. And part of that might have been driven by economies. People have needs. People are finding ways to meet their family income needs, meet their income needs to be able to pay for schools, to be able to pay for elder care. So let's say that there's resource needs that are driving practices. That could include using natural resources that are increasing that wildlife density. But it could also mean that there's practices related to wildlife trade or wildlife consumption, because those are ways to meet fiscal or caloric needs. But what we know is those conditions have the potential to cause viral mutation and viral spread. And as we have seen with SARS-CoV-2, but also with Nipah, also with Ebola, also with SARS, sudden acute respiratory syndrome, there is the potential for diseases to emerge. So what then happens when we have weak surveillance systems that can't detect and respond quickly to emergent viruses? What happens when we have leaders that might not be leading with a clear voice and giving clear direction about how to prevent and how to protect populations? What happens when we've had divestment in public systems for a long time, such that we have high rates of chronic disease, high rates of individuals who don't have access to preventative health care, and thus put them at higher risk for morbidity and mortality with new and emergent diseases? And what happens when we don't have effective geopolitics, where there's in fact tension between and across borders? Well, hopefully you're all thinking, ugh. Well, what this means is there's a tendency to push towards maybe even more precarious practices, because the economy is challenged. As the economy is challenged, people struggle more with homelessness, struggle more with food access, struggle more with needs. And I think that is at the core of what you're talking about in this seminar, of these drivers that begin to push migration. And as that migration happens, whether it's to the next town or whether it's to the next country, as a part of that, there has the potential to also be changes in practices to just meet those very basic needs of shelter, of food, of air, of water, of love, of connectedness, of income, of employment, to be able to become and be, in fact, the people that we're here to be. So with that, I'm going to pause and I'm going to see what kind of Q&A there are.
Did you want to go ahead and take questions in the chat, or do you want to go ahead and open up the Q&A part of the session?
I'm
Jen?
sorry, I didn't see the Q&A. Okay, open.
Okay. So I'll invite everybody to feel free to post questions using the Q&A button. And I'm also going to go ahead and come on and maybe get the conversation started, if that's okay. So, hi everyone, I'm Eleanor Painter. I'm a postdoc with the Anati Center here at Cornell and with the Migrations Initiative and working with students in the Migrations course. And Jen, this was just really a fascinating talk, and I find it very, just really a helpful perspective to be able to, I feel like I have gained more tools for thinking about this issue in a more holistic way. So thank you for that. And as we see what questions are coming in, well, I'm going to start with one that's maybe it's definitely highlighting my approach to these issues are mostly coming from a humanities perspective. And so one of the questions that I have in thinking about the planetary health lens, and you had a slide that highlighted the Anthropocene. I think there's a push in work done on the humanities to think about how we can decenter the human in some of these conversations. And that seems to, that would be problematic if we're thinking about how to prevent disease, right? So I wondered if you could say a little bit about what's the place of the human in thinking about planetary health? Or are there ways in which we should, using that lens, are we sort of trying to reimagine our position in the world? Are we trying to think from different perspectives? Or is it more about acknowledging some of the broader dynamics that are at play here?
Eleanor, that's a really good question. And I'll answer from my interpretation of how I use planetary health to think about what I do and to use it to try to educate, empower, inform. Others, of course, might feel differently. One of the things that I think about a lot is we as humans are motivated by wanting to have our needs met. So I think there's some value in having that human-centered approach because it's a motivation for many of us. What my approach is to try to understand myself, the relationship that I have to animals in my environment, or I would say to the ecosystem. So animals, plants, air, water, everything. And I find that is really helpful because it gets me outside more, which I know is really good for my health and well-being. But seeing some of the data that have come out of the original Planetary Health Commission, it's just, I think, a stark reminder that we live in a way that is very comfortable to us, and that uses a lot of resources. And some of us, like me, use more resources than others. And so I think for some part of the population, there's real value in being able to look at and utilize those data to help us think about how do we do things differently? How do we do things in a new way, in a more innovative way, to in fact start to see, instead of exponential rises in almost everything, like how do we start to do that? So I guess it's like leading from the human side, but utilizing the data to help create a greater connection to an awareness of the natural environment that we're really dependent on.
Thanks. That really resonates with me in thinking also about our experiences as part of the ecosystems in which we live too, instead of somehow separate from this world. In some of the readings that we've done for this week, so people are talking about biodiversity, but also biosecurity. And I wondered if you could say a little bit more about those terms. You used biodiversity in your talk, and I didn't hear you talk about global biosecurity, but I wonder if that's something that, is that a new idea, or is that something that's relevant for COVID conversations?
Yeah, so biodiversity is are the different types of living things that we have in our environment, and our world has been built to have this very nice natural balance, and when we come in and do things, we disrupt that balance, and that kind of pushes these balancing loops out of whack. Biosecurity is this idea of effectively how we stop things like SARS-CoV-2 from spreading, yes, between species, but more importantly, between borders. And that can be city borders, state borders, county borders, and global borders. So biosecurity is this idea of having an ability to better detect and prevent and respond quickly and urgently. I think, SARS, the original SARS, sudden acute respiratory syndrome, was more people died from being infected from SARS, but fewer people became infected. And I think, looking at that in contrast, there was an ability, because the virus was transmitted in a slightly different way, we were able to detect. And I always talk about, like, you find the point source and you put a fence around it, and you contain people that have the potential to then spread to others. And that's what we ultimately want to be able to do through biosecurity. Is we are aware that there's hundreds of thousands of pathogens, viruses out there that have the potential to mutate, that have the potential to infect humans or animals. And what we want to be able to do is have stronger systems to detect and respond to those before impacting large numbers of people. And what we've unfortunately seen is, over the last number of years, not only a divestment in the US public health system, which many of you may have heard about or read about in some of the the news that's been out and about for the last 9 months, but investment in global biosecurity has also been decreasing over time. And so I hope that this is a bit of a recall to action to think about how do we reconvene and buoy up the systems that were already in place and strengthen them to be able to do their job. So there are great biosecurity components in place. I think what this has shown us is there's probably better ways to be able to utilize those.
Thanks. We have at least 2 questions that have come in that I think are good ways to build on what you've just been talking about. So one is taking us back to the question of food systems. So this comes from Laura Miranda, who says, I'm interested in the way that these diseases can impact food systems. How can agriculture, in particular livestock, especially since it itself plays a role in that environmental degradation that creates the conditions for outbreaks to start? So how can agriculture be organized to reduce jumps from wildlife to livestock?
That's a great question. And Laura, I'm not an expert in this area, so I'm going to share my perspectives. So I think there's a couple of things that come to mind. First is that animal-based agriculture in some locations can actually have a valuable role on the environment, and especially when also taking into consideration the economic and food and fiber and fuel roles that animals can play in communities. So I think, the first aspect is, being able to look at the balances and the environments and the conditions where people are and where animals are, to be able to assess, is this a right fit for this environment? I think, what we know about viruses jumping from one species to another is, largely around stress. So when animals are confined together and when there's conflict and competition, that is when people's stress or animal stress hormones increase, and that there's this potential for transmission. So I think where there's opportunities to keep species segregated from each other, where there's space to think about less density, more spacing between. And then, of course, we don't have detections for all types of diseases, but I think being quite aware, just as we do human-based surveillance to try to get a sense of if somebody is sick, and to be able to support them and help not spread whatever illness to others, the same it holds true for animals. And so having strong animal-based or agriculture-based surveillance systems to be able to make sure that there is strong herd health can also be an important role.
I wanted to jump in. So the idea of herd health is very interesting to me, because despite biosecurity measures that might be put in place in order to prevent disease outbreak nonetheless may materialize and manifest, especially in situations where you have viruses that are able to hybridize. And basically it's like that game of evolution, like natural selection. So what if I'm the virus, how can I best transmit myself while also remaining in a vulnerable population? So the issue with agriculture today and virus outbreaks is the fact that many of, whether it be cows or pigs, are genetically similar. And when you have a virus that's able to, let's say, spread through an aerosolized manner, right, and affect many pigs in a given area through the air, it opens them up to susceptibility. So that particular genetic uniformity, right, to increase production for these particular agricultural systems, whether it be a meat packing industry or anything like that, even has areas of susceptibility where biosecurity measures, when implemented to the umpth degree, still has the potential to cause significant viral outbreak.
Mm-hmm. Yeah, Blake, that's a really great comment. And some of my colleagues who work in this area, specifically with herd health and animal health, have been a part of some of these livestock outbreaks, especially in some countries in Asia where a virus has been introduced and they've had to do massive culling of large groups of animals to be able to try to get ahead of the virus.
This is maybe a good place to bring in this question from Car Robeson, who's also in the migrations course. Car asks, thank you for the wonderful lecture. What role do multinational corporations play in the deforestation and mining of resources? The presentation was presented on more of a local level. So can you address the role of multinational corporations here?
Again, Car, this isn't exactly where my area of work focuses on, but my initial reaction is quite a lot, right? And I think I mentioned earlier on that we at the local, I think I asked you to think about at the local level, how much impact we have on our natural resources, but how some of that is really driven at scale by shareholders and by interests of organizations that need to push things forward. So I think, part of this sort of collective advocacy that we need to be thinking about of driving change, not only at our local level, has to be in the form of advocacy and being quite vocal about what it is that we want, what is okay. And I think some of the initiatives that we see with banks and with investment and with retirement funds should be shifting their investments from organizations who might be more so focused on some of this deforestation and mining and trying to put it more into companies that are showing that they're putting planetary health and climate change up front is a great example. And I think we all have a role to play in doing that. It's more impactful change, but it's also way harder to affect that. But we I always talk about this. We have to have a local focus and a global focus working concurrently, because if we make changes at the local level but nothing changes at the global level, this can't go to scale. And it seems like, and at the same time, if we do stuff only at the global level, it might not actually have an effect at the local level.
Thanks. Maybe we can come back to this question too if we get a couple more comments or questions related to the role of corporations. I am seeing also that we have a couple of questions related to migration, and these are striking to me also because, of course, in this series we're thinking about migration from these very different perspectives, and today we're thinking about the movement of disease, but we're also talking, of course, about human migration. And so there's a question here from Jimmy Lawrence. From your lecture, I get the idea that COVID-19 spread is mainly due to migration of humans, which is obvious for the initial spread of the virus. However, as things become more dire due to the virus, it makes sense that human migration would increase due to the reasons you mentioned. Do you think it's possible the spread of COVID-19 at this point is more due to lack of education or perhaps scientific illiteracy rather than human migration, or is migration still primary? So what's the role of migration in the spread of COVID-19?
Oh man, Jimmy, you ask a really good question. And just for fun, and it's going to be totally illegible, but I'm going to share my screen again, and I'm just going to give you a little snapshot of some of the things that we've been thinking about. Let me see if I can do this. So, this is part one. Well, actually, there's sort of three parts to the systems diagram: drivers on this side of what led to COVID emergence, the COVID outbreak, and what has happened since then, and some negative effects and some positive effects. And then related to that, all sorts of really great juicy questions, the things in green around the outside that are allowing us to sort of ask really good questions like you're asking. So right now, based on what I read all the time about COVID-19 spread and how to stop it, I would say everything but the kitchen sink, pretty much, right? So we see that travel is still a huge, a very high risk activity, meaning somebody can be living in a place where there's high rates of COVID-19. They may or may not know that they are infected. Lots of transmission happens from people who are asymptomatic. People travel for work reasons, people travel for family reasons, whether urgent need or whether mental health and well-being, or whether just to get away and to see family. We know that gatherings, things that we are so naturally inclined to do, right? Get together and share food with each other, get together and have drinks together. We know that these are also high-risk activities. We also know that things that are very core to our happiness, playing sports, singing, playing music together are also things that have the potential to drive transmission. So I think that travel or migration, whether it's permanent or short-term because I need a place to live, I don't have enough money to pay for food, yes, has the potential to be a driver. I think a second thing that has a potential to be a driver is are some of those social determinants that I mentioned. We know that people who have maybe not had access to preventative healthcare in prior years and may have underlying chronic diseases are more at risk. We also, we might imagine that people who are homeless may find themselves in higher density living situations because they don't have anywhere else to go right now. We might also find that if people are trying to meet basic needs, they're taking lower wage, more precarious work so that they're in environments that opens themselves up to more exposure. So I think both of those. I think the third factor then relates to, I think, yes, scientific illiteracy or, right, there's some who focus on being driven by news and being driven by data and facts. And then there's some who are driven more by emotion. And so, that definitely plays in. And as we know, there's many people who don't believe in COVID-19 or many people who don't believe that we need to have these sort of layered mitigation strategies. And then I think the fourth thing is this is really hard. And I don't know if the hand raising function works, or maybe you don't even want to raise your hand, but how many of us are really tired, right? This has been 9 months of doing something pretty darn atypical that, we are being asked to live life, to study, to work in ways that are very, very different. We're being asked to not spend time with friends, to not spend time with family, to not travel, to maybe alter field work, to do classes remotely, all these things. And we're 9 months in. And I think here in the States, at least, well, actually many other countries as well, we're not yet ahead of the curve. And so fatigue is definitely something, pandemic fatigue is a word that you've probably, or term that you've probably heard around, that we're all just getting tired as well. So those are, I think, 4 different things that I just mentioned that have the ability to really be driving infection, transmission, and continued reality that this virus is in our community.
Thanks for that answer. And circling back to the question of migration, I think it's also useful to think more broadly about questions of travel. We often get focused on, when we think about migration, sometimes we focus on what's happening at the borders and with asylum seekers and refugees. But of course, that's another side to this story too. And Macy Berryman is asking to think a little bit about that. So as I'm thinking about, it's true that we've had to limit our movements, of course, but as we've also shut down the borders, we've left people in camps and in precarious situations where the disease is also more likely to spread. So basically, Macy Berryman is asking, I was wondering what your perspective is regarding refugees and immigrants coming to the United States, as they are typically without those basic needs such as water, food, job access, etc. Yet, as mentioned, increased population compressed into one area can be a challenge for the host nation. Do you think the current refugee program is effective? I'm not sure if this is in the scope of what you're prepared to talk about, but maybe you can comment on some of the aspects of refugee movement and what happens to people living in more dense populations. So for me, this would also be a question about what's happening for people who are having to live in camps because they can't enter a country. And I see this question also as, can we welcome people right now?
Yeah. Oh, great question. Again, not my super area of expertise, but I will do my best to respond from my perspectives. So, first and foremost, when we think about COVID transmission, we know the conditions that are more likely to drive infection are being in enclosed spaces, being close to people, maybe underlying health conditions, maybe higher levels of stress, just weaken our immune system in general, being close to people who might be coughing, who might be yelling. So if you think about high density situations, such as, camps, holding environments for refugees who are moving from point A to point B, but also, prisons. We also have seen really, really high rates of transmission among prison populations. So, we know all of that. And I think from a public health perspective, what we would be trying to do is to not have those conditions. So in that respect, whether it's, do we have camps or not, I won't speak to that yet. There are people who have needs, and we don't want people to be suffering in point A, and we don't want to have people suffering when they're being held between point A and point B. So I guess what I'm trying to suggest is, like, I tend to be more in favor of open and accessible immigration. I tend to be more in favor of really being able to be responsive to and in support of refugee populations and being able to meet those needs. And layered on top of that, we know right now that if we don't create the proper conditions, that there can be a fire of COVID-19. So how does that play out in our current environment, where our national leadership has different perspectives or I have different perspectives, I guess, than our national leadership. I don't know. Would I suggest sending people back? No. Would I suggest welcoming people in? Yes. Would I suggest having much more humane and anti-COVID not friendly environments? Yes, absolutely. Would that take resources? Yes. Would that take partnership? Yes. Do we have the potential to do that now? I don't know. I will say, one of the things that we saw, and it's on the slide that I had shared before, is we saw some really kind of interesting things happening early on. So some of these downstream effects of what was happening with COVID, and as we were having more awareness, and especially of some of these conditions. And we saw early on that some prisoners were being released early. And, so one of the questions that we have is, how can we build from the innovation and collaboration that has been demonstrated in this time of urgency, right? There were some quick decisions that were made to change the status quo in support of health and well-being. And this is a real opportunity, I think, for us to think about being able to maintain some of those changes, as opposed to just like going back to the status quo when COVID isn't with us anymore. Sorry, Blake, you were going to say something.
Yeah, I think that this entire topic speaks to the manifestation of stratification within society, whether it be prison populations or nursing home populations or asylum groups or refugee groups. It reinforces and how, like, governmental action or lack thereof and disproportionate effects within those communities reinforces how the second-class citizenship of these particular groups, and it also reinforces systems like, not really systems, but terms like xenophobia and how that relates to disease spread. And it's like the government is putting these groups, or particularly in the case of refugees, into situations where disease most likely will break out. And as a result, those individuals have a great proportion of disease infection and thus contributes to xenophobia and second-class nature of stratification for people of color generally. And we talked about that in not last week because we didn't have class last week, but the previous, I think it's week 6, with Professor Dudley, and she was describing how within a particular community, a small community where you had frontline workers not getting the proper protections, there was also a belief that those workers were the ones who are principally responsible for disease spread within those communities. So we can also talk about how all these factors relate to reinforcing second-class citizenship as well.
Right. And not to mention those frontline workers often, in many cases are some of the lowest paid employees, right? They're the ones who are really dependent on, hourly wages to be able, and they might be working 2 or 3 days, it's just, yes, absolutely what you say. Like the other thing I wanted to mention is, we're still really, really early on. I mean, there's so many amazing things that are happening through this current pandemic. I mean, I have never seen science and public health work so fast to try to pull pieces together, right? Like I used to work in HIV, and I mean, even modes of transmission for HIV, it took us a good 3 or 4 years to really understand that before being able to have, comprehensive prevention messaging. And so the fact that we were able to get a good understanding of COVID transmission in, I don't know, a month or 2, and we've refined it since then, has been just truly breathtaking. Related to that, though, and especially coming back to the more vulnerable populations, especially prison populations and refugee populations and nursing home, is that there is some early indication that infection with SARS-CoV-2 may lead to longer-term chronic illness. And I think we really won't know the impact of that for some time. But even knowing that there is the potential for that and an indication of that from an ethical perspective, it just, public health ethics and public health law, and then there's all the stuff in between. It just, from an ethics perspective, really drives my, conviction that we should be doing everything we can to not have conditions where disease has the potential to spread, right? We living here on campus in this community or offsite, we have some choice. Maybe not if we're in a shared room, that limits choice a little bit, but we have choice in our movements and our abilities. And we know that if somebody is diagnosed, that they will be put into isolation, there will be a quarantine process, like there's resources to support this. If we don't have processes like that for routine surveillance testing, for routine screening, and for support for isolation and quarantine, it makes me feel sad about what might come in the future.
We have a question from Priya Pradhan about thinking about interventions and approaches, and building on this slide that you shared also about where you mentioned innovations and collaborations. I wonder if this is a chance also to maybe highlight some of the possibilities that you see for that or some examples. But Priya's question has floated to the top of my list. Hold on. So you mentioned the importance of both local and global level interventions and approaches. How do we reconcile the specialized focus of bottom-up movements with more wide-reaching top-down implementations? Is there a way to make these approaches meet in the middle or balance the two? And I wonder if you have some examples in mind as you think about this question.
So Priya, in this case, I'm just going to speak from my experience. So I've had the opportunity to do a lot of field-based work, but also be, in effect, a messenger or representative to national level government and then global funders. And I don't know, what's a good analogy I can use? The best listener and the best cheerleader at the local level and a broken record at the top level. That's a little bit of a joke, but not really. I think, the stories that come from the ground level, in my experience, are some of the best catalysts for change at the top level. And one story of need, or one story of innovation, or one story of change from a local level might not be sufficient. But if you can collaborate with other communities, with other organizations to compile stories of need or stories of success, stories of opportunity, and compile those to share with a higher level, I think that human interest, I mean, Eleanor, it kind of comes back to your question. I think, people really want, in general, people really want to help other people. And so being able to talk about both what the needs are and the opportunities are have benefit. I think the other piece that is really valuable to remember is that going from a bottom level up, it can be annoying to the people at the top if it seems like complaining all the time. And so another strategy that I think is very important to remember is lead with strategies, or lead with options, so that the decision makers at the top almost have a menu of ideas that they might modify, but it's not like you're going to them to say, we have this problem, we need you to solve it. Rather, we have this problem, here are ideas that we have for solution finding. We'd like to work with you to be able to implement that. What I mentioned before about listening and being a cheerleader or an advocate, or a strong advocate, having a strong advocacy voice at the local level, I think does truly, I mentioned broken record at the top, and I think it's not being afraid to continue to share that message and those ideas at the top level, but also being able to be a mediator or a moderator. So there, it's not uncommon for there to be, real differences between what the priority focuses are of a community or a national or multinational level, and what a successful practitioner, public health leader, facilitator, all of you can do is try to find that meeting in the middle. And so, many of you have probably taken the IDP workshop, intergroup dialogue project. I think it's part now of many students' orientation. And some of the tools that are taught in that, of just like dialogue across difference and trying to find commonalities, is truly what has been, in my experience, a key to success. And so people might start off on very opposite sides of ideas, but trying to find a common theme that can then be braided together to get people at least talking together is the best way that I've had. So being a fearless advocate, but also being super respectful and listening a lot, and then trying to be a bi-directional messenger to support coming to that shared focus.
Thanks. And can you say a little bit more about how that might, how those strategies might come into play when one of the questions is has to do with a cultural practice? And going back to your example of bushmeat, or maybe you have another example, what kinds of maybe community engagement work have you seen that make a better conversation there possible? Or what are some of the particular challenges in that kind of work? Or what can you do to honor a cultural practice if it's been identified also as potentially the source of a related to a health problem?
Yeah. So I haven't worked specifically with bushmeat trade or wild meat consumption, but I have worked with in the field of HIV and with sensitive topics related to, and cultural practices related to sex between men, related to male circumcision, related to what we would define as sex work, but in some cultures it's just more of a normative practice to be able to support income and livelihood. And I think the worst way is to say, don't do this, because none of us want to be told that ever. I think, in my experience, it's taking the time, and it doesn't always work in an emergency scenario, but taking the time to understand the drivers behind those behaviors, to understand what some of the cultural practices and norms are, and then to have conversation about the risks, and to not presume that we have the solutions, but to work with community leaders, to work with gatekeepers, to have them become the champion of this topic, and for them to be the one to start to be the solution finder and the social norm changer. So it takes time, and I I think I mentioned earlier in my talk that these planetary health issues that we are grappling with are so hyper dependent on human behavior change as well as policy change. If you ever want a job that you'll have forever, become a public health practitioner, because we don't know how to really effectively change human behavior for good and forever, right? We are very interesting beings. We have many, many different drives and motivations, and our drives and our motivations change over time. And so, what is the best way to lead behavior change? It's really to be working with the community in which behavior can change, and have them be the ones to identify how those norms can change.
We have one last question. I'll make this the last question that is maybe connecting to some of what you're saying now. And that's taking us back to the issue of climate change, which was one of the threads in your talk as well. So this question is from Vanessa Olguin. What's the role of public health scientists in the climate change discourse?
Great question. And I'm trying to think of just the right way to say it. So, planetary health is a relatively new field. And I think this is, it was just such an amazing opportunity and an amazing presentation of exactly this, the link between health and climate and resource use. So I think this investment in planetary health, in research on planetary health, on dissemination of the impacts of planetary health, human health on environmental health on human health, the bidirectionality of that, and the case studies that are coming out of this focus. And many universities, many schools are starting to integrate this into teaching, including here at Cornell. I think one of the other interesting things that I've seen, and it's come out a little bit more through COVID-19, is I think just the maybe elevation of recognition of public health, and that public health is really this broad-based focus that seeks to prevent illness and prevent harm and to assure health and well-being. And a recognition that some of what climate change and environmentalists have been trying to do for a long time, that there's a really nice link to some of the public health methods and public health paradigms that are used. And so I think there is more dialogue now emerging between those groups. And there was one thing I was going to say that I just forgot. And then this even more, even greater emphasis, not just on racial justice and social justice right now, but on environmental justice. Because if we think at the base of that health impact pyramid, and that the natural environment that we live in has actually a ton of influence on the social determinants of health, the environment, do we have access to clean water? Do we have access to clean air? Knowing that the built environment that we live in has the potential to squash people together or give people nice distance. So I think, Vanessa, the role is be active, work together, and utilize each other's knowledge and experience to catalyze impact working together. And I think the planetary health framework has really laid some super positive groundwork for that.
Thank you so much for the talk and for your answers to this set of incredibly relevant, but also really tough questions. And I think it's especially important that we're thinking about this together right now. And so thank you for giving us ways to process this and also think toward the future. I really appreciate it. And thanks to the audience for all these great questions. Thanks also to Blake Martin for the introduction and for joining in with the Q&A and discussion. And I will close by just reminding everyone that we're continuing these conversations. Next week, we have a talk by Wendy Erb on the ecology of state building, moving capitals in Indonesia. Same place, same time. See you on Zoom. And Jen, thank you again so much. And look forward to continuing the conversation.
Yeah, thanks everyone. And somehow I hope that I'll see you on campus one of these days when we're walking by each other. I didn't get to see all your faces, but say hi to me, please. Maybe with a mask on.
Thanks, everybody.
Thanks, everyone.